First up, let's begin with all the COVID figures. As of today and at this moment, India has over 2,73,000 fresh COVID cases in just one single day. 1,600 lives lost in one single day. This means India at the moment has just witnessed its deadliest day and a day where all previous records have been broken. We have never been this bad since the onset of the pandemic last year. This also means that this is the 5th straight day where over 2 lakh cases have been reported. Let's look at some figures over there. Because at the moment, what's most worrying at this point is not just the number of cases rising up, but deaths, lives which we seem to be losing hour by hour. Let's bring out the graphic for you. Deaths in April, in this month alone, with just 19 days down, are almost rising at a 10% average. Look at the data over there. Look at how it was during the first wave, how it's been through the beginning of the year, and where it stands now. Compared to the first wave, the deaths 10% up. Also, let's give you a picture of how it looks like when put this way. Deaths in April alone have exceeded those in January, in February and March. That number constantly rising. So on the program today, the question that we're asking, everybody seems to be going after Remdesivir. There is a severe shortage. Chief ministers are writing to import it from countries like Bangladesh, etc. The government of India has put a cap because so much of black marketing was happening. In Maharashtra, for example, stocks go missing, then found at a political party office. But here's where we separate the facts and from the myths over here. Who are the people at this point who need Remdesivir? When do you need it? That means at what stage in your treatment do you need Remdesivir, and how do you access Remdesivir? If you also have a question regarding it, be sure to call us. The numbers will just come on the screen right now. We've got experts for you and we'll have them answer those questions as well. The number is 8377088377. I repeat, it's 8377088377. On that note, let me bring in my guest. Today we've got Dr. Sumit Ray with us, joining us from the Holy Family Hospital in the National Capital. We've got Dr. Sunila Garg, Professor of Community Medicine and also member of the Lancet Commission on the COVID India Task Force. Thank you both for your time. Dr. Ray, if I can just begin by asking you, a lot of people are trying to pile up, stock up, buy it in black. We've seen some painful pictures and SOS messages going all over. Could you just, for the benefit of our viewers, explain what exactly does Remdesivir do and at what stage does a patient really need it?
So Remdesivir is an antiviral. One of the interesting comments that was made about it is Remdesivir is an antiviral in search of a disease. It failed in Ebola. Okay, let us be very clear. It is an antiviral that is being prescribed. Unfortunately, it has become so much in the public domain that it is sometimes impossible for doctors to not prescribe it almost, because families demand it. But let me tell you the evidence for it. The evidence is very weak. The only evidence which suggests is only for those patients who are on minimal amounts of oxygen, they may benefit in terms of just reduction in the length of stay in hospital. For severe cases, for those on ventilators, non-invasive ventilators, HFNCs, ICUs, they will not benefit in outcome. They do not reduce death. Let us be very clear. So don't run around helter-skelter trying to find Remdesivir. If it has been prescribed and you are not finding it, one, the prescription numbers has to go down. And if it has been prescribed and you are not finding it, don't panic, because it is not a magic bullet which is going to save the life of your loved one. So rather, we should concentrate on, good quality care, supportive care. That is the most necessary thing in all severe viral infections. Along with that, there may be basically steroids are needed, antibiotics if there is secondary infections, etc., supportive care, oxygen, and in a very, very small subset with very severe disease, you may need certain special drugs. I'm not going to name them because everybody will start running around for those drugs. Okay, let it be prescription dependent. Remdesivir, if your loved one is sick, significantly ill with COVID, the likelihood of Remdesivir benefiting your loved one is very, very little. So do not go crazy trying to look for Remdesivir.
Right. We've understood this from you in repeated episodes, but what I'm failing to understand is then why this sudden surge has actually happened. Dr. Garg, could you shed some light on it? How is it that suddenly we see more and more families running after it? Clearly, a lot of it is panic struck as well, but some hospitals and doctors also prescribing it or perhaps over-prescribing it at the moment.
Sonal, it's a very nice question, and as Dr. Sumit has pointed out, that we need to have a standardized course of management. This Remdesivir came in due to, when we used it during Ebola time. But if you will look at, we will require only 2 to 3% of the cases, not even that. 90% of our cases are mild to moderate, which do not even require hospitalization. And let me also tell you with regard to hospitalization also, quite a substantial proportion of hospitalization are under pressure, or the people are they are insured and all that, and that's where they are admitted. So we need to reduce this load on the hospitals as well. Now coming to the Remdesivir part of it, this should be given particularly in, I'll say in the severe cases, and that too you see once the person is under supervision of the critical care person, and that is where, why we are running helter-skelter and not because there is no standardized management. In morning also I got one prescription from a provider that it was only a local prescription. I said, why do you need it? I said the doctor can manage the pneumonia by several other means if it is there, and if the patient really requires, he will be managing it. The question is that we need to have standardized treatment guidelines which are already there, and the prescription auditing needs to be done right now, including the admission auditing. I will say that whether these people they require auditing or not, every now and then I'm sure Dr. Sumit also would be getting calls. We are also getting calls that how many people require bed, but when we really find out, it's not the actual requirement of the bed. So this is where we need to look at that for every treatment we have to be very, very rational, whether it is Remdesivir, whether it is oxygen, whether it is hospitalization.
Okay. Since you've understood that, and I really hope our viewers are listening in very carefully to what the experts are saying right now and not just going into a panic mode. We also spoke about this to the director of AIIMS, and this is what Dr. Guleria said when asked about the same issue.
Dr. Guleria, everybody wants to become a doctor these days because they are hearing about medicines, people are panicking. So in simple terms, when does a patient need Remdesivir? What is the difference between Remdesivir and a steroid? Is it a steroid? What is dexamethasone? What is ivermectin? And what is Fabiflu?
Okay, so when we start looking at the treatment strategies for COVID-19, it is evolving, but we have learned a lot over the last 1 year. Remdesivir is basically an antiviral drug. It was basically developed for the management of Ebola, and that is where the evolution of Remdesivir happened. But initial studies were done to look at its utility as far as COVID-19 was concerned. The first paper that came out from China actually was a negative study and showed it was of no use. It did not show Remdesivir had much effect, and this was the first study which was published in the New England Journal of Medicine. Subsequent studies did show that Remdesivir was useful only in people who had moderate to severe disease in decreasing the hospital stay by about 4 days. There was no mortality benefit. By taking Remdesivir, the study did not show that you could save lives. You could just decrease the hospital admission. And it was only found to be useful, and it was given when your saturation fell to around 94 or less, or there were infiltrates in the chest X-ray. So this was usually around the 5th to the 7th day. There is no utility of giving Remdesivir on the first day, and the data does not support it. There have been doctors who have argued, I hold regular EICUs with many hospitals across the country. Many doctors have argued that they feel that they should give Remdesivir on day 1 because it's antiviral and it will kill the virus. The data is not there that it is that effective as an antiviral drug. As of now, we don't have a good antiviral drug. And I personally feel that we've done a lot of aggressive research in developing a vaccine, but we've not developed a treatment for COVID-19. Let's be honest about it. We don't have a good antiviral drug. Even the other drugs that you mentioned, favipiravir, is basically an antiviral which was for influenza. It is a drug approved for the treatment of influenza after the H1N1 pandemic. And there are studies which have looked at it. There is a randomized control trial which has shown it may be useful even for another viral infection, Ebola. But the data for COVID-19 is not strong enough. And therefore, again, it's not something that can be recommended. And even if you look at the national guidelines or the guidelines from our institute, which we've updated recently, we don't really promote FaviFlu that aggressively. Same is true for ivermectin. So none of these drugs are very useful. Coming to dexamethasone and steroids, now those are the drugs which have been shown to be of some use in the recovery trial. But again, I would like to stress that it's not only the drugs, it's the timing of the drugs which is also very, very important. Steroids given early, before there is a fall in saturation, in the recovery trial showed a negative result. They showed that those who got steroids did worse as compared to those who did not. Right. The benefit of steroids was only in those who had given steroids when there was a fall in oxygen saturation and in the later part of the disease. As a matter of fact, previous data for viral infection, including for swine flu, H1N1, was negative for steroids. The utility of steroids is only for the cytokine storm or the inflammatory reaction which occurs after the viremia. So in my opinion, steroids are very useful but should not be given early. They should be given if your saturation is falling, if you're having infiltrates in the lung. Along with that, they can really be life-saving and they can actually save lives. But giving it too early may actually promote more viral application and may actually cause more harm. Same is true for tocilizumab, which is basically a drug which is for cytokine storm. Unless you have evidence that you are having cytokine storm late in the disease, there is no point in giving tocilizumab. Again, it decreases your immunity to a large extent, and we have seen people who have had fungal infection after getting tocilizumab because it really decreases your immune system, and therefore again, the drugs are useful, but the timing of drugs has to be very, very critical. You can't just give one cocktail on day one and assume that the patient will be all right and something will work. That strategy is totally not correct.
All right, so those are the best of doctors in the country telling you that this is not a magic medicine that will prevent you or bring you out of COVID. So do remember that. If you have questions, be sure to dial us on the numbers that are flashing on the screen right now. On the other side, we'll be taking some callers and Dr. Garg will be answering those questions. Welcome back. So we try to tell you that there is no need at the moment to rush in and try to stock up or even pay in black to try and procure Remdesivir. It is no magic pill at the moment that can help you either keep away from COVID or to help you cure as well. Dr. Sunila Garg remains with us. So let's take our first caller now. We have Madhusudan from Noida joining us. So Madhusudan, please go ahead with your question.
My question very straightforward. My aunt is actually diagnosed with COVID and she's in requirement of the medicine, the injection basically Remdesivir. Now the prescription is there for 6 injections, but I've been sourcing left, right and center and not, getting any positive response from any pharmaceutical. So if you guys can help me in any which ways, thank you.
Could you tell us, Madhusudan, at what stage, what is the condition of your aunt and what hospital this is?
So I've actually, looked at the comments from the doctors and it's the similar situation. It's not that severe. It is at the stage where you can actually, give these injections and she can just come out of the hospital. That's what our requirement is and that's why it's been prescribed as well.
Okay. Dr. Garg, so there are patients who genuinely need it and intervention is required. What should they do?
Basically, first of all, she is in which hospital in Noida? We have to look at that part, and then we have to have a dialogue with the doctors that basically an alternative can be provided. As we say that right now we just discussed that only Remdesivir is not the answer.
Is there an alternative that they can try?
Definitely. You see, it is a consulting doctor. He will have a review at the situation. And, it depends upon how much is the, involvement of the lung. And that's where we need to look at from that perspective also.
Okay. So, Dr. Garg, could you tell us what are the alternatives really at this point to Remdesivir?
Primarily, we have to first see that, as was pointed out by, Dr. Sumit also and Dr. Randeep also, that Remdesivir is not the only answer. It is required for very, very critical persons, and that was only tried, earlier. We also found in several papers that this is not the only answer. So we can use other repurposive drugs because that will depend upon, the prescriber's habits. Also, other antiretroviral drugs are also there which can be used. But Remdesivir is not the answer, let me tell you, because I cannot put the, the drugs into doctors, this thing, because every doctor has got its own prescribing habits. And I will always say that, whichever hospital it is, let the hospital procure the medicines. If they are prescribing it, let them procure it themselves, which is there with them. And then basically two things which always work are oxygen and steroids. These are two things which will always work for the patients, and see that the oxygen level does not fall. That is important. And as was pointed out, good counseling, care and support is one thing which matters for the patient. And then again, let's see whether it is a viral pneumonia.
Dr. Garg, that there is no room for counseling. We barely get any FaceTime with the doctors at all. So that's clearly for another day. Devendra Kuvar is with us, joining us from Ahmedabad. Please go ahead with your question.
Yeah.
Yeah, hi. I'm been diagnosed with rheumatoid arthritis. So I'm on regular ACQS and steroid supplement. And on a week, I need to go for a methotrexate injection. So on such condition, on immunosuppressant condition, am I allowed to go for a vaccine? That's my query.
Sure. Actually, you should go for the vaccine because you are already, suffering from rheumatoid arthritis and you are on immunosuppressants. But you have to talk to your provider that, you can skip the dose of immunosuppressant before the vaccine, and you can take it just after the vaccine. So that is important part. So you have to just consult your provider and take your medication paper also to the vaccination.
All right. So consult your doctor and ensure that do get the vaccine. That's number one.
Yes.
There is no reason that you should be skipping at all. But do keep your doctor in sync as well, and let him decide how he wants to move around your questions. All right. Sohail from Karnataka is with us. Go ahead with your question.
My question is why government don't want to be a PharmD graduates to work for COVID task force, as already lakhs of qualified PharmD doctors are eligible to work as a studied equal to the MBBS and trained in allopathy, and they are studied for 6 years for this course.
Dr. Garg.
Yeah, I feel that, you're talking of the family physicians. That is, if I could get you correctly, because family physicians can do a very important job of, identification and referral of those who are really requiring them. And also at the same time, you see, basically, I feel that if I have got your question correctly, that you are a family physician and you are an allopathic doctor. Did I get you correctly?
No, Dr. Garg, he was trying to say that there should be more and more students who are not qualified to do very major who are not MDs, etc. at the moment. Shouldn't they also be used in the force to try and fight out the disease? I think there is no, there is really no other answer to this. More and more people are required, should be brought in.
But they can definitely, Sonal, participate in rapid response team where they can help us in testing, treatment. So they can help us in identification of more and more people. And then, they can facilitate their testing part and they can put them to liaison them for the treatment and isolation also. They have got a very, very important role to play, because I feel that what we lack today is correct information. This is where, if we can given the opportunity, they will be definitely utilized, because we have lot of dearth of manpower as far as, we are working on rapid response teams who are working on testing, treatment and track.
Information is key, facts are key, so keep yourself braced with all of those. We hope today's episode has been able to help you and tell you that please do not rush for Remdesivir and do not get into a panic mode. There are enough supplements to it. There are enough things that you can take in place of Remdesivir, if that is, even if you need it at the first go. So keep yourself informed. Thank you, Dr. Garg, as well, for joining us with the very latest. That's it on the program. We'll catch you again soon.